The side effects of family planning are numerous, but also they do not apply to everybody. That is why I'm not going to say that for every patient, for every lady who is using this family planning, you are going to get all these symptoms. Hello everyone, you're welcome to this video. Today I want to share with you about side effects of family planning. First off, we want to start by saying that family planning is not to force a specific number of children on anybody. It is the role of the mother and the father of the child to decide. It is you to decide for your family, the husband and the wife, to decide the number of children that they want to have. If you want to have 4 or 5 or 7 or 8, according to your capability, you are seeing that that is what you want. All of that is your choice. As doctors, we come and give you medication to just help you with spacing of these children, but not to decide for you that 2 children are good for you or 3 children are good for you. So there are many people in this modern era that are taking family planning, and people are having complaint of very many complications or side effects, but also others are thinking about things which are not side effects of family planning. I want to tell you from a professional point of view that family planning does not cause cancer. You need to take that from me, that it has been tested and proven it does not cause cancer. That is a misconception, that is a misinformation from people who are not medical personnel. But we have studied, we have read, and we know even the medicines that are inside that we are using for this family planning. We know what it does to your body, and we know what your body does to it. We know what it does and what it does not. So cancer is out of the equation for family planning. In fact, research has actually shown us that family planning prevents certain kinds of breast cancer and certain kinds of uterine cancers. We know that. So instead, it prevents others. It does not cause. Now, what are its side effects? My name is Dr. Bale, who is always bringing this kind of information to you. I am the founder of BOBALE Healthlink Clinics Uganda and BOBALE Healthlink Clinics in Tororo, which is in Eastern Uganda. We are here in Eastern Uganda and reaching out to the world. You can watch us and listen to us from wherever you are. We bring you this information which is proven and tested for the purpose of improving the health of humanity. The side effects of family planning are numerous, but also they do not apply to everybody. That is why I'm not going to say that for every patient, for every lady who is using this family planning, you are going to get all these symptoms. It does not apply to everybody. Some people may get one, and other people may not get that, and a specific type of family planning may cause A in a person B, but may not cause that in the next person. So do not again listen to your friend telling you that for me when I take that one, it causes me a lot of bleeding. For me when I get that, it causes me to gain a lot of weight. It is not universal. It applies based on individuals. That is why we always tell you that you go to your doctor and discuss this, and then we will choose an option for you. In the case after some period this thing is not working for you, this specific method is not working, then we can be able to suggest to you the next one. One may not work, but the next one may work perfectly. So do not just say that no family planning method works for you. Now, we have excessive bleeding that many women come with, especially after using family planning methods like injector plan, like implants in the arms, they sometimes complain that there can be bleeding. But again, from over 10 years of experience, I have seen that this does not apply to every woman on those family planning methods. It is specific to individuals. That is why we need to select for you one, we monitor how you respond to it, and in the case it is giving you adverse effects, we can be able to choose another for you. Then we have also seen other side effects like weight gain. Some people get weight gain on injector plan, they get weight gain on implants on the arms, but again, it is not a universal matter that every person who uses those will end up with those specific symptoms. It is not universal. Kind of subscribe to our YouTube channel. You can also follow us on TikTok. We run an online clinic called BOBALE Healthlink Clinics Uganda. You can get us on Google. Kindly check in there. You go to our website. We have an option for registering. Once you have registered, we have a mobile app called Continuous Care that you can download from Play Store or from iOS. If you are having an Apple phone, then you can be able to log in with your username and password, which are created from the website. Once you do that, you can be able to book a doctor anytime. In the case you're dealing with complications, we can be able to attend to you. If you are near Tororo, you can kindly come to the clinic and we can be able to attend to you from the clinic. The other side effects of family planning, for example, the one which is inserted in the uterus, we can have a side effect of recurrent infections in the vagina, but this is something that we can be able to deal with because we are supposed to, in all these complications, gauge between the benefits and the risk which is posed on the patient. There is no drug that does not have any side effect. You know, even Panadol, there are some side effects that we know that you as patients you may not see. You know, so all these drugs we usually balance between its side effect and the benefit that we get out of it, and that is the same for all drugs, including the family planning drugs. So kindly, family planning is good. It can help you to space your children and to achieve a specific number of children that you want to achieve. You can subscribe to our channel for more medical videos. Thank you very much.